Okay, so first what I'm going to do is gather all the equipment. I would grab my blood gas kits, and in here I have sterile gauze, a biohazard baggie, 2 labels that are pre-printed for the patients, an alcohol wipe. I'll have a needle with a syringe attached to it, the point lock device to discard the needle when I'm done, and that is a cap for that. So once I have all of my equipment, then I'm going to check the patient's chart. I will confirm the order, and in their chart I'm going to look for their any ventilator changes or like FiO2 changes, and if there were any changes made, then I'll wait 10 minutes to get accurate results, or 25 minutes depending if they have a air trapping lung disease or not. Then I will also look for their coagulopathy, and I'll check their PT, PTT, INR, and their platelet counts, and I'll also check all of their medications they're on to see if they're on any anticoagulants. Then I'm going to wash my hands and don sterile gloves, and then I'll enter the room, knock on the door, and introduce myself, say, hi, I'm Megan Doherty, I'm a respiratory therapy student, and inform them that I'm just going to be taking some blood from them. And then I will have them confirm their date of birth and their first and last name for me, so I'll confirm the patient. Then I'm going to palpate both arms and on their radial pulses and find which one's stronger, and that's the one I'll use. If they're the same on both arms, then I'll just do their non-dominant hand. And once I've chosen what arm to use, then I will perform a modified Allen's test. And then after that's done, then that's a good arm. I can use that one. Then I'm going to scrub the site down. Well, I actually have this. So I'll scrub the site down with the alcohol wipe and allow that to air dry. Then I will place some gauze on their forearm so it's ready when I remove the needle. Then I'm going to aspirate 1 milliliter or close to 1 milliliter of air into the syringe. So that's ready to use. And then I will palpate the pulse. Oh, should I have someone squeeze this for me?
Oh, yeah. 1 second.
I will palpate the pulse continuously, and then I'll position my needle at a 45 to 60 degree angle with the bevel side up, and I will go parallel to the artery against the flow of the blood. And then I will inform the patient right before I put it in that I'm going to do so, and I will stick, can you squeeze that a little harder? Yeah, thank you. Make sure I'm feeling that pulse.
Yeah, squeeze it hard.
I will insert it in at the right angle and wait until I see any blood enter in to the hub of the needle. In this case, I don't, oh, it's good? Okay, it's good, I guess because we're using an arm, it's not working. Okay, so I have that, and then I will remove the needle slowly from the patient's arm, having this ready, and then I will take that, the gauze, and I will apply that for at least 5 minutes or until the bleeding stops, and then I will be able to place this, I'm just gonna imaginary do it, I will be able to place that in there or use the one hand to cap that, and then I can dispose, keeping pressure on that, I can dispose of this, and I would put this in the sharps box and dispose of that properly. Then what I'm gonna do is cap the syringe, and assuming this is all filled with blood like it will be on a real patient, I will flick the syringe to get all the air bubbles out of that and make sure that that's all taken care of. And then I'm going to rock and roll to make sure the heparin is evenly distributed through the blood so nothing coagulates in the meantime. And then after I do that, I'm going to label it with this label and place it in a biohazard bag to be sent off and analyzed. And then after 5 minutes, I will take this off, and if the bleeding has stopped, then I'm done with that. So I'll complete the procedure, and I will make sure I'll make sure the patient is feeling comfortable and is okay, answer any questions they have, and place their call button with them in case they need anything. And then I will leave their room, and I will go analyze the sample and then chart everything.